The new BMJ Best Practice Comorbidities tool supports the management of the whole patient by providing guidance on the treatment of acute conditions alongside pre-existing comorbidities. Let's look at how the Comorbidities tool works in practice. An 82-year-old man comes into the emergency department with an acute exacerbation of COPD. He also has type 2 diabetes. Having searched for COPD, the doctor goes to the topic summary page and selects the treatment algorithm to find advice and guidance on management. They are prompted to consider their patient's existing conditions. They are alerted that treatment options may be affected by the selected comorbidities. The selected comorbidities are shown at the top of the screen, and affected treatment recommendations and urgent considerations are clearly indicated by the comorbidities symbol. When the doctor selects the treatment option, the adjustment is highlighted, with recommendations based on evidence and expert opinion. There are also helpful tips and prompts, in this case when to consult a senior or specialist team.